All right, let's get some reaction from Europe now on the death of Prince Philip. We're joined by our SABC News correspondent Lucy Hough in Brussels, in Belgium. Lucy, thank you very much. What sort of responses are coming in?
Well, great sadness from European leaders with whom Prince Philip had a close working relationship. We've had various messages from European leaders, German Chancellor Angela Merkel amongst them, who said, "The death of Prince Philip fills me with great sadness. His friendship with Germany, his straightforwardness and his sense of duty will not be forgotten." French President Emmanuel Macron also tweeting his condolences to Queen Elizabeth II, saying that Prince Philip had led an exemplary life defined by bravery, a sense of duty, a commitment to youth and environment. There have also been a number of messages of condolences from European royalty, the royal families of Belgium, of Sweden. Prince Philip was a British royal, but he came from very European heritage. He was born in Corfu with his grandfather, the King of Greece. He then was forced to flee Corfu as an 18-month-old and then spent time in Paris before ending up in London. So a very deep commitment with European countries and certainly European royalty, talking of him as a much-loved relative who will be missed for warmth and friendship and that unique sense of humour.
What about the general public? I guess it's hard to gauge across the whole of Europe, but you mentioned there are royal families in many European countries, but none so high profile as the British royals. And some people looked at that askance. Some people enjoyed it from afar. Where you are in Brussels, is this high profile news, is the question?
It certainly is, but of course not as high as it is in the UK or in America. I mean, you know, Europe is still in the grips of a very serious situation with COVID-19. The streets in Brussels, where I am now, are pretty deserted, given that we're back under lockdown in order to get those case numbers down. So the reaction here has been slightly muted. Certainly the news has made waves. It has been met with shock and sadness. And as I say, that very solemn response from European royal families, amongst them the King and Queen of Belgium, who tweeted a photograph of them with the British monarchs, as well as condolences from the King and Queen of Spain, as well as Sweden, who again described Prince Philip as a close relative. So there is deep sadness here, but yes, as you say, not quite the outpouring of grief that we're seeing in the UK at the loss of such a constant figure in public life.
All right, Lucy, let's look at other news coming out of Europe. The big news is the European Medicines Agency talking about Astrazeneca. And this just keeps going round and round in circles. Maybe it does cause these rare blood clots, maybe it doesn't. What is the EMA saying and what implications does that have?
Well, the EMA has come out this week after a really extensive review of these blood clotting cases that we've seen since the Oxford Astrazeneca vaccine started to be rolled out in Europe. We got some figures. Some 34 million people have been given the Oxford Astrazeneca jab, both here in Europe and in the UK as well, of which 222 have developed these very rare cases of blood clotting disorders, which is a really tiny percentage of the total. So what the European Medicines Agency has come out and said is that really these are very, very rare side effects that nonetheless should be listed as such, but that the vaccine should continue to be rolled out in Europe, given the seriousness of the situation here in terms of the continued COVID-19 risk and the pressure on hospitals across the bloc. So on balance, EMA said that the benefits of this vaccine far outweighed the risks of a very small number of side effects. But nonetheless, European nations who health is a national competence, meaning that individual member states have the power to make their own policy, have taken that guidance. And nonetheless, we had a number of countries who came out and introduced restrictions for younger age groups, Spain, Italy and here in Belgium, restricting that vaccine in the under 65 age groups amid fears that, broadly speaking, the majority of cases affected by these clotting disorders were female and they were in younger age groups. So despite that clear guidance from AIM, some countries still deciding to, out of precaution, put some kind of age limit on the rollout of their vaccine.
All right, Lucy Hough from Brussels, thank you very much for your time tonight. Let's